What is substance use disorder? According to the American Psychiatric Association, substance use disorder is a complex condition in which there is an uncontrolled use of a substance despite harmful consequences. Some of the most common substances include alcohol, opioids, and marijuana. It can range from mild to severe addiction. Substance use disorder is considered a treatable mental health condition. According to the American Psychiatric Association, the signs of substance use disorder include but not limited to taking the substance for longer time and larger amounts, having a strong desire or urge for the substance, an inability to cut down the substance use, and developing a tolerance. The Cleveland Clinic categorizes the symptoms dependent on the type of substance used and based on when or if it is in the body. They categorize it into two headings: intoxication and withdrawal. Intoxication, defined as the immediate and short-term effects of substances in your body. Symptoms include fatigue, calmness, excitement, or heightened emotions. The substances can alter the judgment, physical or mental functioning, and decision-making. Withdrawal is defined as symptoms caused by the wear-off of the short-term effects of the substances. Symptoms include nausea, vomiting, diarrhea, sweating, insomnia, muscle cramps, and mood difficulties. Substance use disorder is a detrimental public health issue throughout Australia, affecting individuals, families, and communities, with increased amounts of hospitalisation and mortality from substance use disorders. The following statistics display how important it is to provide education and support for individuals within Australia. The third most prevalent category of mental health illnesses among Australian adults, with an estimated 650,000 or 3% in 2020 and 2022 in a national study for mental health and well-being. Although men are more likely to develop substance use disorder, women face more stigma and barriers in seeking assistance and support. 3.3% of Australian people aged 16 to 85 years have had symptoms of 12-month substance use disorder, and 4.4% of males reported 12 months of substance use disorder compared to 2.1% of females. Risk factors associated with substance use disorder come under categories of biological and genetic, psychological, and social and environmental. Biological and genetic factors include family history of substance use, gender, and early exposure, and psychological factors include co-occurring mental illnesses, example depression, anxiety, and low self-esteem. Social and environmental factors include peer pressure, family environment, and socioeconomic disadvantages. Following the risk factors that can be associated with the formation of substance use disorder, also look at some serious health conditions that may be caused or worsened by substance use disorders. For example, cardiovascular disease, gastrointestinal issues, respiratory problems, liver damage, kidney damage, and neurological damage, as well as a diminished immune system function and the ability to fight infections. Although we focus on the reasons why someone develops the disorder, in mental health it is important to stay strength-based and look at the positive and protective factors that one may have in place. Some examples include education and employment, strong cultural identity, and positive peer relationships. Treatments for substance use disorder. There is a comprehensive range of treatments and aftercare for those who suffer from substance use disorder that is provided by local New South Wales government districts. According to the New South Wales government, they offer opioid treatment programs and involuntary drug and alcohol treatments. Opioid treatment programs seek to reduce the social, economic, and health harms associated with opioid use. OTP is the deliverance of pharmacotherapy and services to opioid-dependent patients. There are 3 types of opioid treatment pharmacotherapy available in New South Wales of methadone, buprenorphine, and buprenorphine naloxone. As found, with New South Wales Health Government, they provide the chance to stop the illicit or problematic use of opioids and reduce the harms that come from such use. The services that are provided with the opioid treatment programs include helping to reduce or stop the use, crisis support and help, information education, supervised reduction, and helping move people to community pharmacy dosing and private prescribers. They also encourage development of relationships with general practitioners. Involuntary drug and alcohol treatment is a last resort option for severe substance dependent people. It intends to protect the health and safety of people with severe substance use dependence. It is provided supervision, medical withdrawal management, and post-withdrawal assessments and treatment in a specialised inpatient unit. It is followed up by a voluntary community care component provided by the local health districts for up to 6 months. Trauma's interaction with substance use disorder. It is known that people who have experienced trauma or have experienced chronic stress might use substances like drugs and alcohol as a form of self-relief or self-medication. There is a high tendency to access drugs and alcohol as a coping mechanism. This is because drugs produce intense euphoria which people crave. They also produce a large surge of dopamine which reinforces the connection between drugs and the feel-good effect. Therefore, when one experiences trauma and increased stress for a long period of time, it can lead to increased drug use. These individuals are therefore more likely to develop substance use disorder than those who have a lower drug use. It is displayed that substance use disorder is a high disorder for concern, especially for younger men, although the risk for women is still considerable. Throughout my extensive research of substance use disorder, I have been able to become more aware that it is a serious issue within the community, and it has a larger range of risk factors than I would ever connected. I believe I can become stereotypical when it comes to drug use and have some assumptions, when in reality it is a lot deeper and can be engraved in someone from a very young age. During SNUG206, I've been able to become more open-minded and break down my own stereotypes and barriers to learning about mental health illnesses and people suffering from them. It reinforces in my mind that a mental health illness does not determine to someone their care, their past, and their future, and we are only just human on the same journey.